So today we're going to be talking about shock. No, not that type of shock. Today we're talking about hemorrhagic shock! Hemorrhagic shock is a life-threatening condition in which you lose 15% or more of your blood supply. The heart is unable to pump enough throughout your whole body, and your whole body goes into shock.
Bill Nye the Science Guy. Bill Nye the Science Guy.
Science rules.
Bill Nye the Science Guy.
Inertia is a property of matter. T minus 7 seconds.
Bill Nye the Science Guy.
Here we have someone donating blood.
Way to state the obvious, Bill.
We're not worried about her going to hemorrhagic shock because she's only losing 500 milliliters of blood, which is, depending on the human, is roughly about 10% of your volume. For hemorrhagic shock, you need to lose 15%.
Alright, there's two main types of hemorrhagic shock. One of them is external bleeding. We've got it right here. First thing we're going to do, we're going to apply pressure directly to the wound and firm. Next, we're going to take vital signs. Then we're going to administer fluids. Then we're going to apply oxygen.
What do we have here?
We have a 19-year-old female. We have a laceration to the left leg. Looks like she's going into hemorrhagic shock. Looks like we might have to amputate. We're going to need lots of blood stat.
Oh, you mean some O-neg?
Alright, the second main type of hemorrhagic shock is internal bleeding. We've got that here. So treatment is going to be very similar to external bleeding, but we need diagnostic imaging to confirm the internal bleed.
Look what Trump tweeted.
Oh, what a guy.
Man, I tell ya.
We need a doctor!
Yep.
We got a 19-year-old female. Came in from a motor vehicle accident. Looks like she's got internal bleeding. We're going to need CTs and blood, probably stat.
Yep. Well, it looks like CT here confirmed an internal bleed, and you might as well just take her to the OR. Gonna be late for my massage.
Did you know that?
So what are the signs and symptoms of hemorrhagic shock? So some of the signs and symptoms can include confusion or dizziness, blue lips or fingernails, shallow breathing, loss of consciousness, low blood pressure, rapid heart rate, or a weak pulse.
So even though internal and external bleeding can have similar symptoms, internal bleeding is harder to diagnose until the person goes into shock. So internal bleeding can also have symptoms of vomiting blood, chest pain, abdominal pain, or swelling.
Isn't that just shocking?
Great pun, Bill.
Now you know!
Shock. Complex syndrome. Characterized with impaired cellular metabolism and decreased nutritional blood flow. Blood drop. Shock. Cardiogenic makes the heart go stop. Anaphylactic makes you swell up. Septic is caused by infection. Hypovolemic is another one, caused by insufficient vascular volume because 50% of your blood is gone. Hemorrhagic is the last one, can lead to hypovolemia due to the imbalance of the sympathetic and parasympathetic. That shock.